Hi everyone, in this video we'll be looking at how a doctor attends to a patient using APMIS platform. But before the doctor attends to the patient, let's quickly look at how the nurse checks in the patient vitals. So once you click on the vitals, you can input the pulse rate, the respiratory, and then the systolic. It's 37, and with this you can go ahead and then add vitals. Click on attend to patient, and then the doctor can simply go to documentation, click on add new clinical note, and then click on this, and then we have the clinic progress note. Presenting complaints, can have fever, can have cold, can have anything, headache. History of presenting complaints, and then if there's a past medical history, you can as well input those data. Then we have next, we have review of system. So these are checklists. For instance, you can check it under constitutional with loss. Then have okay, so you can look through. Under examination, so it can have well hydrated. Even for me, I can put in the diagnosis. For instance, so we have a working diagnosis to be malaria. And then if so, we have what is called plan. The plan allows you to be able to use a template protocol. So for instance, so the facility can create, can have multiple templates created within the system. For instance, for malaria, maybe for different, kind of ailments. So for instance, I have a template called malaria here, which I can select. And if I click on that, so it gives me the medication for the treatment of malaria, the investigation that the patient have to undergo, if there's a need for procedure, nursing care, and other stuff. So you can go ahead and use the protocol. And okay, but for the purpose of this, I will cancel this because the information are not properly configured. But it's just for me to show you that I can use a protocol, and then that automatically create what is called treatment sheet. And then if the patient is on admission or the patient have to come intermittently for maybe injection or maybe wound dressing or some other stuff, so the nurses can attend to the patient using the treatment sheet. All right, okay. So you can click on complete, and that saves the information. If I click here, so we have this information. Okay, this was taken by 11:29. So that is that. Okay, I think another one was taken. Okay, um, 10:59. Okay, so if the doctor is not using the plan, okay, for the lab investigation, the doctor just simply type, for instance, MP malaria parasite, and then checks this, and then automatic system tells you that the investigation is 1,000 naira. But if the investigation is not being done within the facility and the patient have to go to an external facility, you can just check the external, which means that the patient is not paying for that. But if I uncheck this, click on this, so this automatically generates a bill. Okay, so clinical information, I'm just putting available. Then the doctor can send the request. Or okay, okay, I will look at that. So the doctor just simply clicks on that, and that sends that. And if the patient have to go to the pharmacy, prescription, then we have paracetamol. Okay, paracetamol, and then you can put in the dosage 500 mg. Then how would the patient, how would the doctor, I mean, how would the patient use it? Let's say um, 4 times a day for 3 days. And then, okay, so you click on hard. Then the doctor can, if there are other, let me look for vitamin, vitamin C. Okay, click on hard. And then once you're done, click on authorize. So this goes to the pharmacy, and then the patient can simply go to the payment and then pay for the drug and then for the lab investigation. So when the doctor is done seeing the patient, the doctor just simply check out the patient. If it's with no further appointment, with further appointment, doctor can select that. And if the patient is going on admission, just if the doctor just simply if the patient is going on admission, doctor just simply clicks on send for admission. Then okay, say with no further appointment, and then patient has been checked out, and that routes the doctor back to the appointment page where the doctor can go back to check in, and then if any patient is available, can go ahead and then attend to the patient. Thank you for watching.